So I have a lot of patients asking me about what kind of function to expect after hip replacement surgery. Well, a hip is a pretty simple system. It's got a center rotation, which is the fulcrum, and you've got the muscles that attach to the femur and the pelvis that are the levers. And, at the end of the day, if the placement of the implants is perfect, you won't perceive a difference between the prosthetic hip and the normal hip. That's what we call an invisible hip. And we shoot for that every time. Our goal is to get the hip that you don't even perceive. Now, does that mean that you can run? Well, sure, you can run. In fact, many of my patients will run and enjoy very active lifestyles. However, there's always a caveat there, is that just respect the fact that you've got a prosthetic device. And a prosthetic device doesn't heal at night, doesn't rebuild itself at night like the normal hip. There's a fixed number of cycles on that implant before it will need to be replaced. And many of these are going 20 to 25 years. But if you're going to go out and run marathons on it, you might not get the same length of duration of that implant. So we encourage people to go run, to go enjoy their life, but to do things in moderation. So if you typically like to run 3 to 5 miles 3 times a week. That's fine. But I don't know that I'd sign you up for the latest marathon.